Okay, guys, today we're going to talk about semaglutide for weight loss. A lot of you guys have been asking for this, so um, let's try to get through this pretty quickly. Okay, so first of all, semaglutide is a great modality of treatment for weight loss. Of course, you guys already know that. It's become a craze in the United States. A lot of people have been prescribing it for a while now, but it's just becoming popular now that a lot of the compound pharmacies have gotten a hold of it. Okay, in this presentation, we're going to explore the indications, contraindications, off-label uses, clinical trials, and recommended protocols. Okay, what is semaglutide? You may also know it as Ozempic, Wegovy, and Rybelsus. They're GLP-1 agonists or receptor agonists. They act like GLP-1s. Okay, the compounds were um, initially made for diabetes. When they did, type 2 diabetes, when they did clinical trials, they found out that one of the side effects was weight loss. Okay. So, and we'll talk about that, the weight loss part with their mechanism of action. Okay. Like I said, they are like GLP-1s. They mimic GLP-1. Okay. Normally released by the small intestines. I believe the L cells after a meal. Okay. All right. And GLP-1 receptors are found in the gastric mucosa. Remember that part. The kidneys, lung, heart, skin, and the hypothalamus. Remember that part. Okay, they belong to a group of, um, or a family called the incretin hormones. You can kind of look up that by yourself. But, you know, they are in the GI tract and released when you eat, typically. Now, GLP-1 is what we're talking about today, but GIP is very important as well. And for those of you who want to prescribe Manjaro, that will come into play. Manjaro is both a GLP-1 and a GIP, but for today, we're going to talk about semaglutide. Okay, so um, just for completeness sake, though, but GLP-1s and GIPs both stimulate secretion of insulin um, in a glucose-dependent manner. That means that if you give someone a GLP-1 agonist and there's no uh, glucose stimuli, their blood sugar is typically not going to drop. Okay, they may get sick or if the dose is too high, but we're talking about hypoglycemia, and so that's one good reason why it's a good modality of treatment in diabetics, because a lot of your drugs or hormones will cause you to, like insulin, will cause your blood sugar to drop, which can be pretty detrimental if not monitored properly. Okay, so there's a couple of different things that it does, GLP-1s. We just talked about one. It also inhibits the release of glucagon from the alpha cells. Okay, typically, when you eat a meal, glucagon raises glucose levels by breaking down glycogen from the liver. So this kind of helps to inhibit that. Okay, and then the other way that it has its effects on glucose metabolism is the appetite and food intake. Okay, so remember we said that they have receptors on the gastric mucosa. Well, when GLP-1s attach to those receptors, it can slow down gastric emptying. Okay, so you have to be careful if someone has gastroparesis. Um, and then also at higher doses, which Wegovy and higher doses of Ozempic take advantage of, is that, remember we talked about they have receptors in the hypothalamus. Well, you have hunger centers in the hypothalamus as well, and so at these higher doses, it can affect your hunger centers by decreasing your appetite. Okay, so we discussed that during clinical trials, they saw that one of the main side effects for um, in participants was weight loss. Okay, and so that's how they got a lot of attention, and so a lot of people who were um, taking Ozempic for diabetes, they found this. All right, and there's I know that so Eli Lilly makes Monjaro, and that actually may be a better modality of treatment for weight loss just because of it's a GLP-1 and a GIP. But some people believe that semaglutide is just as effective. At least it's more well known. Okay, so indications for semaglutide, of course, diabetes. If you were doing or if you were using somebody's insurance, of course, insurance companies have their own reasons why they wouldn't want this to be prescribed. So they make you go through prior authorizations or step therapy and things like that. Step therapy meaning they would probably have to try something like metformin and then fail that, um, or not respond to it uh, as much as you as a physician or you as a practitioner would want. Then you may also have to try something else like glipizide or a combination or even one of the SGL2 inhibitors. So I say all that to say for weight loss, the main criteria or indication is being overweight. So BMI of 30 or BMI of 27 with a comorbidity. Okay, so hypertension, of course, we all know that what hypertension is, linked to cardiovascular disease, all right, and diabetes. We know all the problems that diabetes can cause. So this is um, one reason why semaglutide is, I think, one of the best drugs out there right now. Monjaro is also a great drug, so that's the reason why we want to prescribe it. We want people to not only look good on the outside, also look and feel good on the inside. Okay, and so a lot of times when people are into aesthetics and wellness, they don't even know what their hemoglobin A1C is. And I typically do like to know what the A1C is, but let's say that they didn't know what it is. They might not understand the reason why they're not losing weight. And so on semaglutide, it kind of makes up for the fact that somebody has a high hemoglobin A1C. And we can discuss how it decreases your hemoglobin A1C. Of course, hemoglobin A1C is your marker of your blood sugar for the last 90 days. And so as you steadily decrease your blood sugar, of course, your hemoglobin A1C decreases. Yeah. So contraindications to semaglutide are pretty simple. I think the main one for me is because I mean the hypersensitivity reaction to semaglutide, you probably would never know, but of course you still have to ask. Like let's say somebody has taken Ribelsis in the past and they don't, you know that it's also semaglutide, or let's say they took Wegovy in the past and had some type of allergic reaction to it. Um, but that's kind of the scenario that I would see playing out if that ever happened. The main one though is the history of the medullary thyroid carcinoma. You want to make sure that, or MEN2 syndrome, you want to make sure that that's not in their personal history, and you want to make sure that MEN2 is not um, in their family history. Okay, and we can look this up on our own, but it's pretty much a genetic disorder that is linked to endocrine tumors. So we discussed that you can use semaglutide for weight loss, of course. Diabetes management is the primary reason why you would use semaglutide. but also for fatty liver and PCOS actually. Okay, especially, and there are some times where PCOS, where I was talking to one of the nurses the other day, where your hemoglobin A1C is not elevated, but especially when it is elevated, this would help with the insulin resistance part. Okay, and then there was another study that showed that it was cardioprotective. So that's another reason why, if someone did have heart disease and they were overweight and have diabetes, they should definitely be on semaglutide or any type of GLP-1. Um, if they had chronic kidney disease, I would also recommend them to be on some type of SGL2 like Jardiance or Farxiga. Okay. Okay, so they did do studies on this as well. So this is what we just discussed because of its um, ability to, of course, improve glycemic control and reduce albuminuria. And I guess let's kind of discuss the insulin resistance. So you have, and it's there's not a slide for this, so because I already assume that you kind of understand diabetes. A lot of people, and this is what I tell my patients, a lot of people think that diabetes is a sugar disease. Well, it's more of a energy consumption disease. So you'll have a lot of people who have diabetes say that I don't have any energy or I feel fatigue all the time. Well, it depends on, of course, your level of blood sugar, or your level of insulin resistance, rather. And so, after you eat a meal, carbohydrates being the most important stimulator of glucose out of the macronutrients, you know that when you eat a meal, and you never know what's actually in your food, when you eat one of those or drink one of those shakes or low sugar or zero sugar in drinks or food items, the sugar that you're ingesting or the fake sugar that you're ingesting, sometimes depending on your genetic makeup and um, if you have diabetes, you can still have a glucose response to that sugar. So they make it seem like, okay, well, this has no sugar, so I've drank, or eaten 4 or 5 meals of this zero sugar stuff, and I wonder why my blood sugar is still high. Well, it's because um, one, if you eat Splenda, which is sucralose, that destroys your gut bacteria, but that's a different topic. But also, if you if you're not monitoring it, you can actually have a sugar spike with the fake sugar. So watch out for that. All right, but anyways, when you eat or drink carbohydrates, it signals your brain to release glucose. We just talked about glucagon, which signals your brain to release insulin. So that increase in blood sugar or sugar in your bloodstream, it releases it or it forces your body to release insulin if you can produce insulin, right, from the beta cells. So insulin's job is to transport or to attach to the receptors onto all of your cells. All of your cells need glucose. We call it sugar. All of them, all of your cells need glucose. So the purpose is to attach to the insulin receptors on the cells and then grab the or transport the glucose in the blood to get into the cells. When you have insulin resistance, it's like a machine. The more insulin attaches to the receptors and cause the transportation of glucose um, into the cells, depending on your genetic makeup, of course, that engine will eventually fail. Some people, it takes a very long time, and some people it doesn't take a very long time at all. And so if you're unfortunate to have the genetics to where it doesn't take that long at all, you have to do certain things to force glucose into the cells or force glucose out of your body. Otherwise, what happens is the glucose stays into your blood, and it typically starts affecting your small blood vessels. So you'll start to see um, blood vessels that supply small nerves, so like your fingers or hands and feet. That's why one of the first signs is of insulin resistance or diabetes is the glove and stocking um, pattern. And so after that, kidneys, eyes, all those things start to get affected because of the sugar damaging your blood vessels downstream. Now, ways you can force glucose into your body, of course, are medications. Um, one of the like semaglutide, like Jardiance, like of course, metformin makes you more insulin sensitive, like Farxiga. Those are probably my favorite medications to prescribe for insulin resistance. Um, or one of the best ways is to actually force the glucose into your muscle cells. So exercise and not just like walking, right? That does help, of course, with lowering your caloric deficit. But lifting weights, especially in the bigger muscles like chest, back, legs, so squatting for a lot of people who want to grow your butte. So squatting, those muscles actually, when you break down those muscles and your body is forced to repair the muscles, it uses obviously glucose. And so the effects of glucose on the fatigue part is this. So every part of your body needs, and I'm not going to get into the full biochemistry, but every part of your body needs glucose. Every cell in your body needs glucose so that it can create ATP for energy. And so if it's not able to do that properly, your cells are not going to work properly. And so that's why a lot of people who have diabetes feel those type of effects. Okay. All right, then. Okay, so this is another trial um, that showing that semaglutide was pretty good for people with obesity. And by the way, you're gonna get a lot of people who are not BMI of 27 or 30, and you have to take it case by case basis. So, and if you're unsure, if you're not a prescriber, so if you're an LVN nurse, esthetician, or whatever you are, you may not be able to make the decision if someone gets semaglutide or not. Like, you're not prescribing it, but there's still a way that you can still benefit from introducing us to the person, and following up with them every month, maybe even injecting them. And so we will compensate people like that, so that you're following the rules. Because if we paid you for prescribing, that would be obviously not kosher. So let's see. Okay, so the protocols, they say it's once a week, right? That's best practices. But like with testosterone injections, there are different people who do different things. But we're for now, because some people inject twice a week. They just decrease their dose in half and inject twice a week. And some people inject daily, right? And then just like with testosterone, some people inject once a week, but once you inject, your levels start going down in the middle of the week. If you and you get like a bigger spike you inject twice a week, you get two smaller humps. So it's a little bit more steady. And some people microdose every day and to try to get that steady effect. That's the reason why pellets over the last few years have become very popular, because you get kind of a steady state of testosterone, especially in women. A lot of guys like the injection because they want to feel stronger, like faster, whereas pellets are based on your cardiac output. And so when you are when you need the testosterone, it's just a smooth ride, and when you don't really feel anything. But with injections, it just gets into your system. Okay, so but the protocols for semaglutide typically is based on the clinical picture, but you typically start off at 0.25 milligrams times 4 weeks, and then titrate up um, 0.25 milligrams every 2 to 4 weeks, depending on the side effects and clinical picture. Okay, and so this will be mostly for my MDs and my MDs, DOs, and NPs and PAs. For RNs, you just need to ask what dose should this person get, and then that's something that we would have discussed with the client. And so yeah, and then we'll make that determination. Okay, the normal cost for semaglutide. Well, in America, things when people do clinical trials, it costs them millions of dollars. So when they release something to market, they're gonna make their money back, right? So Ozempic in the United States is about $1,000. Rybelsus about $1,000. Monjaro is like $1,200 to $1,500 per month. So Wegovy $1,300. You see this. So when you when you're prescribing these medications, they say that when you are, if you are struggling financially, it's just hard to even it's hard to do things in the world, to eat right, to get in better shape. The best gyms are like $50 to $200 per month. Um, there's just a lot of things that wow, there's a lot of things that are kind of against you. Um, but we try to do our part by kind of staying in the middle of the pack. For compounded semaglutide, we're not going to hit somebody over the head. We're going to charge $400 per month, right, for 4 doses. And then during promotions, we can decrease our price to 250. Right, labs themselves, that's a hard cost. I actually prefer people come um, with labs already done. I like to get a full picture of what's going on. So I get a CBC, CMP, hemoglobin A1C, vitamin D, testosterone, estradiol. You can add FSH or LH if you want. TSH, free T4, B12. Um, those are pretty much the things that I get, and there's a reason why. So somebody could not be losing weight because their B12 is jacked up, or vitamin D is jacked up. Vitamin D plays a large role in a lot of your hormone synthesis, or their testosterone is jacked up, or so there's a lot of different reasons why someone can't, or TSH is one of the main culprits. So there's a lot of reasons why. So our job is to, on the surface level, find out, if it's due to a lab, but it could be something like leaky gut. It could be some other inflammatory issue like celiac. It could be a lot of different, not celiac, but a lot of different things why somebody's not losing weight. Somebody with celiac may actually be smaller because they have they're not able to hold anything down. So let's see. And so this is just a conversation, guys. So when you guys are, and I know my sister just called me, when you guys are, and I'm not going to edit it out either. So when you guys are watching this, I want you to, um, I want you to write down the questions that you have about semaglutide, and of course, if I can answer it, I will. But I wanted to do this live tonight, but a lot of people were not able to attend. Um, and then also I'm traveling as well, so let's have a better discussion. I'll send out maybe a uh, like an Eventbrite or some type of event space to where we can um, say when we're all available to kind of meet and discuss for about, you know, 20 to 30 minutes about semaglutide. What are the next steps in Jane app, and um, how does the consult go, or questions about the consult. Where are the best places to inject? What materials you need? Um, how do you even approach somebody who you may think needs semaglutide? Things like that. By the way, I would approach somebody with a business card. Just tell them what you do, and then, um, yeah, tell them what you do, and they will be intrigued. Okay, but so the social media works too. But I am more of a, okay, let me hand you something. I want you to see what I'm doing. I want to get to know who you are, and then let's see if there's synergy between us, right? Because I don't just choose any patient or any client in anything that I do. A lot of times, I like to I like somebody to you know get my vibe, and vice versa. Okay, like the other day, I met Rudy T at Texas. By the way, Texas City, guys, is gonna be a nice place. I met Rudy T at Texas City. I mean, he's just him and his wife. Wow, they're great, and their favorite center, of course, is the Chemo. All right, so moderate side effects of semaglutide. This is something that you need to pay attention to: constipation or diarrhea. Right, I've heard a lot about both, really, because it can slow down your gastric emptying, but in doses that are maybe too high for the person too quickly. I've heard about water, like a lot of abdominal pain and a lot of watery diarrhea. So you have to pay attention to that. Hypoglycemia part is mainly when you combine with other um it's not insulin lowering medication, but it's obviously glucose lowering medication. Let's see. And then, more severe side effects. I haven't had the opportunity to come across this, but pancreatitis, you want to watch out for that. So if someone is having prolonged upper epigastric belly pain, we definitely want to make sure that we can evaluate that. And then kidney failure. I've never had that side effect either. A lot of times, semaglutide helps with kidney issues because it lowers your glucose, um, okay, and lowers your albuminuria. So, but definitely we want to look out for these things. If you ask your clients, are you having any upset stomach, nausea, headaches, anything like that, you want to make sure that you can evaluate them, bring them in. Okay. So we definitely want to educate our patients and set good expectations before they actually receive any medications, right? Expectations are better than someone finding out later. So as we have come to understand with Replenish. So one, you want to make sure that they understand how to administer the medication, right? It's a subcutaneous injection, 2 or 3 finger breaths away from your belly button. It's pretty simple. We use insulin needles to do it, usually a 31 gauge. And so the pain is like a prick. Sometimes if you go into the right spot, straight into the belly, pinch the fat, go into the belly, you don't really feel any pain. But of course, you have small nerves and things like that around the area. So if you go and you hit a nerve, um, or hair follicles or anything like that, you're definitely going to feel a little bit of pain or a lot of bit of pain. Um, yeah. Okay. And then you obviously need to talk to them about their their lifestyle modifications, not just nutrition, but also exercising and things like that, and then make them aware of the side effects. Okay, so for follow up, I definitely want people to, after they start, if they're not a semaglutide vet, I want them to, after the first week, see how they're doing. If they say, "Oh, I haven't felt anything," that's fine. That's okay. Maybe they have some insulin resistance. We're still going to keep them at the same dose for at least 2 to 4 weeks, right? There are some people who need to be on a higher dose because they actually have insulin resistance and just, you know, don't have a hemoglobin A1C on file. Now, if they're not feeling any effects of that, they should get one, right? And even if they don't want to pay for the labs, that is something maybe they can go to their primary care to get hemoglobin A1C or do you know, a, a spot check so that we can find out if their dose is too low. But I like to use some type of evidence before I increase their dose prematurely. Okay, so it's we can talk about the consult a little bit more. But of course, when you're doing any type of consultation, doesn't mean you're prescribing. When you are introducing the the a different modality for somebody, it's just like if you're recommending a movie to somebody for the first time. Of course, if it's your friend, you don't have to introduce yourself. You should know your friends. But if you are, you know, if you don't know somebody, you should always try to gain some type of rapport, right? Sometimes you don't gain rapport, and that may not be the person that you need to actually interact with. That may be somebody um, else's interaction that's supposed to happen with somebody else. And then you just talk to them about what they've done to lose weight in the past. Talk to them about how much weight they want to lose. Set realistic expectations. Some people do lose a lot of weight, but they're really dedicated. I had a client who lost like 40 pounds. They wanted to lose 40 pounds before 40, and she lost it like in, I think, like 3 or 4 months. And I was like, whoa, that's pretty good on semaglutide. But she also, of course, watched her diet and exercise. Okay. And then you need to also discuss any comorbidities, especially diabetes, thyroid cancer, um, sleep apnea, CHF. Sleep apnea is also a big, big thing or disease process that people kind of take for granted. It can lead to a lot of different things that we are not aware of. We speculate that it can even lead to some cancers, but primarily increased systemic vascular resistance can lead to a lot of different things. Um, Diabetes, of course, high blood pressure that is not controlled typically with more than one or two medications. Uh, Prostate issues. When you have sleep apnea, systemic vascular resistance increases your right part of your heart. It responds by increasing atrial natriuretic peptide or AMP, which causes a lot of people to urinate at night. So when you have somebody who has prostate problems or possible prostate problems, and you just attribute the nocturia to the prostate, it could be sleep apnea as well. So a lot of times when you fix the sleep apnea, some of that goes away as well. So that's something that you should think about. And we also have a program to help people with sleep apnea. Okay, and then talk to them about any allergies to medications, and then of course let them know how to do a sub Q injection. You can show them the first one, or you can do all of their injections for them. Okay, and then talk about labs. If they have labs, we need them. We want them. The most important one is hemoglobin A1C, of course. Also, you want to get B12, TSH. Okay, and then set realistic expectations. Like I said, you don't want somebody to believe that, okay, because um, somebody else lost 40 pounds in 4 months, you don't. That's not a realistic expectation for everybody, especially if you are just using it to suppress your appetite, but you're still eating whatever you want. Yes, some people still lose weight doing that, but that's not something uh, that I would be a proponent of. Okay, then our process is pretty simple. After the consults, um, clients pay via the Jane app or Go High Level, and we can share a link for that. Okay, they usually need about 4 to 6 months to achieve their goals. They can also pay for that in a package if they want. We'll have a package promotion. It'll be less than the $400 per month. Okay, and then we will send some type of assistant to you to either deliver the doses to you or directly to your clients if they are, already very familiar with the sub-Q injections and you have seen them inject themselves via telemedicine or in person. Okay, so the main thing that I see with a lot of practitioners is this: we don't know where we're getting the semaglutide. I mean, we know where we're getting the semaglutide from, but we don't know what concentrations are in stock at the different pharmacies. We're not a compound pharmacy, right? So if we go to pharmacy A and then next month go to pharmacy B, yeah, we vetted both of them, but the concentrations might be 5 milligrams per 2 mLs, or 5 milligrams per 1 ml, or 1 milligram per 1 ml, or 2.5 milligrams per ml, right? And so you need to be able to say this is their dose in milligrams because that is not going to change. The units may change, and you can explain that to your clients because and we'll try to be very consistent, but um, for instance, 1 milligram per ml versus 5 milligrams per ml, the number of units is going to multiply by 5. So if you were injecting somebody with 5 units of 5 milligrams per ml, you will have to inject them with 25 units of 1 milligram per ml to get the same effect. And so they'll say, whoa, this is kind of a lot, but they don't understand the conversion. You have to understand the conversion, and we'll also have a backup on a I'll have a backup on a Google sheet, or not a Google sheet, but one of our encrypted um, sheets, um, and it'll show me what the milligrams are, and then it'll show us what the units are when we input the like a dose calculator. But of course, we can do stoichiometry and actually figure it out ourselves as professionals. If you don't know how to, we need to. That's the first thing you need to work on, because I've had clients from other places tell me, hey, like 1 month, I just got a bottle. It didn't have anything on there. Last month I had 25 units, and then they told me to go to this many units, and then my stomach was just in, like, I didn't know what was going on. I will never take semaglutide again because of that. Well, it's because, you know, you have to explain things to people. Even if it goes over their head, you still have to explain it. All right. So we want to dose in milligrams and then convert it to units. All right. Then the materials that you need, of course, it's not that many materials. You need the medication, of course, alcohol wipes, gauze, and of course you ice to put the medication on, and then insulin syringes. All right. So we've kind of already discussed this. We want to set realistic goals. Of course, I want everyone to have 100 clients per month, right? But let's first start with your first 5 clients. Okay, if you are interested in semaglutide, you need to have at least 5 clients within 1 or 2 months, and this is because a lot of people with Replenish, they want to jump the gun and be making, $1,000 a day, right? Yes, that was in the ad, but that is of course not going to be an everyday thing. If you made $1,000 a day, trust me, I would I would love that. But it's when you work, you should make around $500 to $1,000 per day, right? You shouldn't take clients that are just doing a lip flip and then that's your only client for the day. That shouldn't be the case, but that is happening, and that's okay. When you're first, when you're new, you want to build up your cachet, and that's okay. But doing some of these other ancillary things in wellness, like IV therapy, like um, semaglutide, like peptides, like TRT, you guys know men and women who would love these things. It's just a matter of understanding what you are educating somebody on, and then just asking them questions or even giving them questionnaires. Do you have fatigue? Have you taken testosterone before? Have you are you having trouble losing weight? And we can create a digital and a link for you that will take somebody to that, because I know you guys know a lot of people who are not sleeping well, who are not who are fatigued a lot, who are having trouble losing weight. There's the list goes on, and so it's really a matter of you actually just getting out there and talking to people. Um, and it could be via social media. Maybe somebody is a very good speaker or orator. I'm not, right? And I don't like social media, so I don't actually go live and do things like that. But in person, I do like to talk to people, right? And so that may change, um, right? If if necessary, I would do things like that. If people like these type of these type of presentations, I'll start doing that and posting it so that we can kind of move forward. We want to grow your business, and then we also want to grow Replenish, which will also help you grow your business. That's another thing. We want to, you know, I created this program not even just for myself, of course. It was for nurses. Like I told you, most of the money that comes into Replenish, it goes directly out to helping you guys figure out other ways to make money. So I don't need machines. I don't need spaces. There are a lot of companies who don't have any of those things. And if I didn't have machines and spaces, I mean, I would be 3 or 4 times more profitable, right? So, but I got those places for you guys so that you can have a place to do your consultations, so that you guys can have a place to do your procedures. And so take advantage of it, because we want to see these programs grow, right? We want to see it thrive. We want to see your business grow. That's the whole reason why Replenish is created, or was created. Okay, and so if you think that one of your a spouse or side not just friend, not not side spouse, one of your friends may need it, right, or a family member, right, we'll give you the okay to start it at our promotional price, right? And so let us know, give us your feedback. If you want more in-depth knowledge, like a biochemistry or um, you know, histology lesson, we can also do that. This is just more of a high level overview, so that you can kind of get started and understand um, what semaglutide is, how to um, look for signs. Well, not really look for signs, but how to treat people who need it, how to identify those people, um, how to um, how to approach people, you know, and then of course why you would give somebody semaglutide, why you wouldn't give somebody semaglutide, and then if you have any questions, just let me know and start getting people in.